Dr. Jaffe, could you help us understand how the LRA by ELISA Act compares to the silicon-based biochip utilizing and chemiluminescent detection method of Vibrant America?
Well, I know a lot about chemiluminescence because I was one of the pioneers in that technology in the 1970s. What you're talking about is what's called diagnosis on a chip. And usually when you talk about diagnosis on a chip, what you mean is that on that chip, you have a certain receptor for a certain DNA sequence or a certain receptor for a certain antigen sequence, but it's silica-based, it's in vitro, it has uncertain predictive significance because it's relatively new technology, therefore attractive to many people who like something new and bright and shiny. The good news is presented, which is you get results, but talk to the lab directors. Ask them what clinical outcome studies have been published in the peer-reviewed literature showing that the results of this test are sensitive, are specific, are predictive, are meaningful, because there are lots of procedures today that give you information, especially of a nutrigenomic or genomic genetic nature. And the best geneticists that I know for sure that they cannot interpret that clinically because of the way the method is uncertain with regard to functional rather than physical information. So Eric Lander, who ran the Whitehead Institute, the Broad Institute, ran the Office of Science and Technology Policy for President Obama, does not recommend doing any of these silicone-based procedures until they validate themselves and then are used successfully in community-based outcome studies. And we have done more community-based outcome studies than any other immunology lab, and every one of our studies has been significant. That means statistically powerful, but at less than p-value of 0.05. But more importantly, we add life to years and years to life, and we have validated that outcome result in the community. So interesting and attractive emerging technology that hasn't yet been validated, in contrast to LRA by ELISA Act, that for decades has been the gold standard and continues to lead.